Maternal mental health is important, it's a public health priority. And the reason it's a public health priority is because of the impact it has on not only families, individuals in families, and by that I mean fathers, the infant and the child, but also society as a whole. It's important because there's no health without mental health, good health. And as in the words of William Wallace, the hand that rocks the cradle rules the world. So to ignore mental health would be detrimental to the way in which a family functions and behaves. The skills of the health visitor are about developing a rapport. She can easily, quickly put that mother at ease, because what we're talking about is trust. What we're talking about is the ability to be able to elicit information that's non-threatening and give advice. The health visitor is able to liaise with other agencies. So she could talk to the midwife to find out what if there were any events during the pregnancy, and equally can talk to the general practitioner or the DPN or the social worker about her concerns. She has that ability. It's not just about talking, it's about listening and hearing what that mother is saying, hearing what her needs are, and actually not being prescriptive, so that you're not going to tell the mother what she thinks she should be doing or how she thinks she should be behaving. You're allowing that mother to be able to verbalise everything that's going on. The health visitor needs to be aware that it's not just the mother's mental health that we're concerned about, but the whole family. And that is to say, includes the infant, it is the older child, it's the father, it's the grandparents, and ultimately it's society too. Because what we want in society is a well society, a society that can work and play. Health visitors are in a prime position to detect and assess mothers who may be suffering from maternal mental illness, because they are the first port of call following the birth of the baby. It makes perfect sense. The value of health visiting in this stage cannot be underestimated. It's an important area. It's as important as assessing the mother's physical health and the physical health of the infant. They're looking at developmental outcomes for the infant. They should be looking for the mental health issues that may arise for both the mother and the infant. We already have people in place who are highly qualified and need to be continually trained. It's a vast area. It's not just something that is taught in 2 days or 4 days. The need for continuing education is important. We need to make a difference to this country. We need to make a difference to the maternal mental health of mothers here. But we can only do that if we know that what we're doing is right. It's evidence-based. There's significant research emerging, and health visitors can actually become involved in that research so that they can bring out the papers. They can have their voice heard as to their workload and their skills. And if commissioners or people who have the money can understand that there is this wealth of potential knowledge, then I suspect that Britain will be in a fantastic place in future years when it comes to the mental health of mothers and their families.